creepy crawlers, paranoid of pesky rodents, don't worry, you're not alone. Everyone is scared of something, but when the fear starts to settle in, it becomes a phobia. According to MedicineNet.com, phobias affect more than 6.3 million people in the United States. Living with a phobia can make the simplest tasks in life the most difficult. Today, we are going in depth of what a phobia really is, a few specific examples, and possible treatments. Men fear death as children fear to go in the dark, was once said by Francis Bacon. There are many types of phobias, some known and some unknown. Such fear of flying on airplanes, seeing chickens, going to see clowns, spiders, and riding in a car. Millions of people are affected around the world by phobias as simple as amethyphobia, or the fear of dust. You wouldn't think dust, so small, would be such a big problem. Statistic Brains stated that the most common occurring phobia in the world stands at 74%, with the fear of public speaking, also called glossophobia. Phobias are separated into three groups: specific phobias, social phobias, and agoraphobia. Agoraphobia is the fear of going out into public. A fear so common, most people don't want to leave the house. You may be walking around with a phobia you don't even know. Symptoms are different for everyone and may not occur to all people. If your phobia gets bad enough, it's your choice to make the decision to see a doctor or therapist. A few specific phobias are aviophobia and mysophobia. Michael Jackson, Whoopi Goldberg, and Jennifer Aniston all suffer from aviophobia. Aviophobia is the fear of flying. Whoopi Goldberg did not plan on flying for almost a decade. With the help of therapists and doctors, she's now back on the plane. Most of us have tuned in to America's Got Talent at least once and seen Howie Mandel judging. Little did you know that he suffers from mysophobia. Mysophobia is the fear of being contaminated with germs. One of the most common symptoms is the repetition of hand washing. In addition, he also takes medication to control his condition. But Mandel isn't the only celebrity who suffers from mysophobia. As it turns out, Donald Trump is terrified of germs. Times Magazine reported that Donald Trump doesn't shake hands because he's afraid of germs. He's been quoted as saying, "I'm going to do everything in my power not to shake hands with a teacher." They have 17,000 germs per square inch on their desk. That's 10 times the germ rate of those in other professions. It's absolutely swarming with germs. Like these celebrities, most people who struggle with the phobia either avoid their fear or must find some sort of treatment. The main goal of treatment is to reduce anxiety and fear to help overcome the problem. Before calling a doctor, there are a couple strategies that can be used to overcome your phobia. Learning and understanding your phobia is the first step of overcoming it. Learning relaxation techniques such as deep breathing, muscle relaxation, and yoga are powerful sources to help overcome one's panic and fear. With practice, you will be able to calm yourself down and get through the fear by yourself. Stay positive and tell yourself happy thoughts about your fear. If those strategies don't work, talking to a doctor may help. In severe cases, a doctor can prescribe medication to treat a phobia. Antidepressants are the main prescription doctors will prescribe, but it all depends on the phobia you are diagnosed with. The alternative to medication is therapy. Finding a good therapist is always a difficult task sometimes. You may not have the money or enough interest to help yourself, but that may be the only other choice you have. Say you're scared of heights and you want nothing to do with them, simply avoid them. Overcoming your fears is something you should want to conquer, but some people don't have enough willpower or mental strength to fight through it. Understanding phobias can help you notice someone who may be going through pain. Although phobias can be confusing to most people, by digging through into different types of phobias, looking at a few specific examples, and finding some possible treatments, hopefully we have cleared everything up. So if you're terrified of flying, grossed out by germs, or intimidated by an audience, now you might understand whether it is fear or if the fear is really a phobia. By calling a doctor or seeing a therapist, most people overcome their phobias. One will now be able to turn that difficult task that was once impossible to possible again.